Good morning, everyone, and welcome to our webinar for World Brain Day today. My name is Magdalene Rogers. I'm the Executive Director for the Neurological Alliance of Ireland. I'm going to hand over straight away to the Vice Chair of the Neurological Alliance, Emma Rogan, who's going to give our opening address. Good morning, Emma.
Good morning, Mags, and everyone. You're very welcome. My name is Emma Rogan, as Mags said. I'm the Vice Chairperson of the Neurological Alliance of Ireland. And it's great to see you this morning, and we're delighted to celebrate World Brain Day today on the 22nd of July. The theme of World Brain Day this year is brain health for all. In previous years, the World Federation of Neurology organised World Brain Day around specific neurological conditions. This year, there is a more inclusive theme, recognising that brain health is an issue for me, for you, for everyone in our society, across every neurological condition and none. NAI have come on board with this theme, organising our event today, which aims to reflect on what we can all bring to the topic of brain health as individual stakeholders representing specific neurological conditions, but with the same challenges and working towards the same goals. I'll quickly run through the three main sections of this event. Dr. Galvin will open by speaking about the World Health Organization Global Action Plan for Neurological Disorders and Epilepsy. It was published in May this year, and she's also going to speak about developments at EU level, highlighting the increasing need for us to come together as a neurological community around the challenges of brain health and brain disease. The second part of our webinar focuses on the topic of brain health and digital healthcare. Discussions on improving neurological care services always come back to the information deficit and the lack of comprehensive health information systems in Ireland to meet the needs of our population, especially those of us living with complex chronic conditions. Professor Doherty and Laura Kavanagh will each speak to this challenge and talk about some positive steps that are at last underway to address it. The final part of our webinar will focus on shared learning, shared messaging, and common goals across the brain health community in Ireland, both from our speakers today, Professor Suzanne Timmons and Kevin Quaid, and also from our Conversations on Brain Health series. Thank you for being here this morning. I hope you enjoy the event, and I'll hand back to Mags Rogers, the NAI Executive Director, who's going to chair our webinar today. Enjoy the day. Thank you, everyone. Mags.
Thank you so much, Emma. We're actually ahead of time, which is fantastic. So just before I invite the first speaker, Dr. Orla Galvin from the European Federation of Neurological Associations, I'm just going to give a few quick words about just in relation to housekeeping this morning. So this webinar is being recorded and it will be available afterwards for people to pass on to their colleagues who aren't able to attend today. We'll be inviting comments and questions via the Q&A and via chat. After each speaker, I'll be looking through the chat, and I'll hope to pose at least one or two questions to each of the speakers. And I just ask people to bear with me. If your question doesn't get answered, we'll do our best to pick them up as we go along, and maybe send them on to some of the speakers afterwards and circulate the information later on. Before I hand over though to the first speaker, we just have a quick poll this morning in relation to the Global Action Plan on Neurological Disorders that Dr. Galvin is going to speak about. You see it there in front of you. I just get my colleague Sorka to do a little bit of background there, just outlining the poll and how to answer it. So Sorka, do you want to come in there just quickly?
Yeah, so it's appearing on your screen there. So the first question is a single choice answer, and I see some of you have answered it already. The second one is optional, so if you've answered yes to the first one, you'll just fill in a couple of words there. And if no, then you'll, again, single choice, answer the third question. And I see actually everyone is completing it there now, so that's great.
That's fantastic. Thank you so much for that. And as I say, we're trying to get a sense, this global action plan was published in May, and we're trying to get a sense of people's overall familiarity with it, first of all, and then just people's thoughts on what, and our expectations really of what this will mean for Ireland. So maybe as that's running in the background, I might introduce our first speaker and just call on Dr. Galvin. Dr. Galvin is the Executive Director with the European Federation of Neurological Associations. So welcome, Dr. Galvin.
Thank you very much, Mags. And I'm sure with those first few words, you can tell that I'm actually Irish-based. So I am very happy to be presenting to you today. I'm just sharing my screen now, so please do let me know if you can see that. Yes?
Yep, looks good, Orla.
Just to say, Orla, we'll end that poll just a minute or two into your presentation, just so it's not distracting you there.
Okay. From my side, I'm actually not able to see my slides clearly, but we'll work through it. So thank you very much. Today, the topic that I'm going to discuss with you is how neurology is becoming a global health priority. For your information, I'm the Executive Director of EFNA. EFNA is the European Federation of Neurological Associations, and we act through 3 strategic action areas, so advocacy, collaboration, and empowerment. EFNA has been around for 21 years and has been serving as the patient voice in policy and advocacy actions across a broad spectrum of neurological disorders in Europe. In recent years, EFNA has taken this policy and advocacy initiative and drive to the global stage owing to necessity, because there was an absence at that level. And EFNA has been serving as the Secretariat for the One Neurology Global Partnership. And what that has meant, in particular reference to the adoption of the Global Action Plan. So back in 2020, when the Global Action Plan was actually a resolution, we connected with member state missions across the globe, ensuring and advocating that the burden and impact of neurological disorders at the societal level and at the economic level, and why neurology deserved to be prioritised at the global level. So today I'm going to set the scene of the global and European picture of policy and advocacy across neurological conditions. And to that end, I'll draw your attention to the Global Action Plan that I keep saying, and on your screen you'll see that referred to as the GAP. So the Intersectoral Global Action Plan on Epilepsy and Other Neurological Disorders, and to the EU NCD initiative, so Non-Communicable Disease Initiative, which is called Healthier Together, and in particular the strand on mental health and neurological disorders. When it comes to the Global Action Plan, in general, broadly speaking, the targets and strategic objectives are around the prioritisation of and strengthening of governance, providing effective, timely and responsive diagnosis, treatment and care for all patients for all neurological disorders, to implement strategies for promotion and prevention, to foster research and innovation into and strengthen information systems. So this is around data generation. And then the final chapter is around epilepsy in particular, so to strengthen the public health approach to epilepsy. So the Global Action Plan deals with everything. It has a wide range of conditions integral to patient support, advocacy and research. And the phrase in the document is neurology through the life course. So this covers all ages, including children and young adults, and addresses palliative care and neurorehabilitation. So this slide is really your take-home slide. This is the slide and information that you bring to your politician. This is the nuts and bolts of the Global Action Plan. So there are 5 strategic objectives, and each have 2 targets. And countries should reach these by 2030. So the first objective aims to make neurological disorders a priority and strengthen governance. So what does that mean? It means that the aspiration is for 75% of countries to have a national strategy for reducing the burden of neurological disorders by 2031. So this is something that patient organisations, that national alliances should absolutely be getting behind, because this is where you can have the biggest impact. And for all countries, so 100%, to implement an awareness campaign to increase understanding of brain disorders and highlight issues such as prevention, the reduction of stigma and discrimination. And I can tell you that a survey by EFNA in 2020 indicated that those living with neurological disorders, 92% of people on their day-to-day lived with stigma, experienced stigma. The second objective, and again, patient organisations and national alliances can really get behind the second objective, is to provide information around the need for effective, timely and responsive diagnosis, treatment and care. So what is the target here is to achieve this objective. We need 75% of countries to include brain disorders as a universal healthcare benefit package. So to include that in their healthcare package, and that 80% of countries should provide essential medicines and basic technologies for management of brain disorders in primary care. The third objective is for 80% of countries to have an intersectoral programme for brain health promotion and prevention of brain disorders by 2031. So the idea here is to invest to protect. The fourth objective relates to research and information. And the goals here are for 80% of countries to collect data on a core set of indicators for brain disorders and for global research output to double by 2031 from the levels present in 2022. And the final strategic objective focuses on a public health approach to epilepsy as a model brain disorder. Countries should aim to increase service coverage for epilepsy by 50% from levels in 2021. And 80% of countries should enact legislation to protect people living with epilepsy against discrimination, and for example, in the workplace by 2031. So you may question why epilepsy is so profiled in this global action plan. A lot of advocacy and policy work was done in the epilepsy space, and the phrase "and other neurological conditions" was added to this policy drive on the back of the work that the epilepsy community had done. So it is not a case that we're singling out by any means epilepsy, it's that the epilepsy community made room for the rest of the neurological disorders to be included in this approach. So to that end, there is a Lancet one-page publication, and I've a screenshot of it here, and that document does give a slight overview of the global action plan, but what I would say is that it also does focus on epilepsy. So if epilepsy isn't your priority area, you might not feel that it is the most relevant to you. What I would draw your attention to is the oneneurology.net resources page. So I mentioned that EFNA acts as the secretariat for the One Neurology Global Partnership. And if you go onto that website and click into the resources page, there are a number of infographics there to assist you in identifying resources at the global level. And over time, and I will draw your attention to the fact that in 2 weeks' time, the WHO has invited us and other NGOs to engage with them on how best to implement the global action plan going forward at the regional and how to support the national level work. So there will be more information on that, but again, it will be after August when we can share that with you. At the European level then, I'll draw your attention to the fact that neurological disorders have been reported to be the third leading cause of disability-adjusted life years. They're also the third leading cause of death, making up for 11.5% of all deaths from non-communicable diseases in Europe. So importantly, this figure does not include stroke. And stroke was reclassified in 2018 as a neurological disorder. according to the ICD-11 that came into force this year. So when we add stroke, the actual percentage of deaths will rise to 20%. This means that 1 in every 5, so every 5th NCD-related death in the EU is due to neurological disorders. And the NCD Countdown 2030 states that the risk of dying from neurological conditions has increased for more than half of countries worldwide. And this effectively makes them the fastest growing cause of death among all NCDs. And it's projected that by 2040, neurological disorders will see a further 50% increase in disability-adjusted life years. And for these reasons, neurological disorders have been included as one of the priority strands in the EU NCD initiative. So EFNA have called for a close alignment of the global action plan with the EU NCD initiative Healthier Together strand on mental health and other neurological disorders. In particular, we have 6 recommendations. They are that national and neurological brain health plans are included, that there is an establishment of a European platform to facilitate the implementation of the global action plan nationally, and creation of a European guide for quality national neurological or brain health plans, to ensure there's awareness campaigns and advocacy programs for neurological disorders, to ensure that there's inclusion of neurological disorders in the UHC benefits package, and to promote, support and encourage routine collection and reporting on a core set of indicators for neurological disorders. And last, but by no means least, that there is meaningful patient involvement. And to that end, on May 12th, EFNA, together with Alzheimer Europe and GAMI in Europe, launched a call to action for meaningful and transparent processes for patient involvement across all sectors of brain health, whether that is in research and innovation, whether that's engagement with clinical processes, clinical trials, healthcare systems, clinicians, and at the political level. We are also seeking endorsement, meaningful endorsement of this call to action between now and mid-September. And from then on, we will be launching social media awareness campaigns around this need for improved patient and public involvement in all processes relating to brain health. So the Healthier Together EU Commission plan on NCDs and what it means for member countries like Ireland. This initiative is based around reducing the burden of non-communicable diseases. The EU has recognised that NCDs account for 80% of the disease burden in the EU and the majority of premature death. Not only do they diminish people's quality of life, affect life expectancy and create numerous challenges, both for those affected as well as their families, they also account for a significant amount of spending on national health budgets and non-health budgets as well, I would like to flag. The Healthier Together EU Non-Communicable Disease Initiative therefore aims to support EU countries to reduce the burden of NCDs while improving citizens' health and well-being as part of a strong health union. So what are these strands? So there are 5 strands. One very broad, which is around health determinants for health promotion and disease prevention. The second and third are around diabetes and cardiovascular diseases. And these are actually being addressed first and packaged in the next wave, if you like, are chronic respiratory diseases, and our strand, if you like, mental health and neurological disorders. So what we do know and what the EU has now recognised is that improved health promotion and disease prevention can reduce the prevalence of NCDs by as much as 70%. Yet only around 3% of total health spending in the EU is targeted towards health promotion and disease prevention. With coordination across strands and close alignment with Europe's Beating Cancer Plan, this initiative helps address the broader issues, so addressing environmental, commercial and lifestyle related risk factors in a more effective and efficient way, and thus contributing to, as their phrase goes, to build a European health union. So this relates to targets and aims to create a tobacco-free generation, improving nutritional quality of food, addressing pollution and climate change, raising awareness of NCDs and supporting early detection. So we need to absolutely flag that one when it comes to neurological and brain health disorders. And of course, for all of our communities, reducing health inequalities. Down to the money matters of this, in terms of financial support, at least 20% of the annual EU for Health budget 2021 to 27 was dedicated to health promotion and disease prevention. So that means for 2022, this is 156 million euros. It's actually not that much. And it's been addressed to targeting Sustainable Development Goal Target 3.4, which is around reducing premature mortality from NCDs by 1/3 by the year 2030. Actions under the 2022 EU for Health Work Programme address health determinants, again, to reduce the risk factors for cancer and other NCDs, addressing diabetes and cardiovascular diseases. So again, diabetes and cardiovascular diseases are, I would say, also ahead in policy and advocacy actions, but they are in the first wave that are being addressed. And later this year, we will hear what the final plan is when it comes to respiratory and mental health and neurological disorders. There's calls for proposals, and as you can see, the distribution of finances has been outlined on your screen there. And for more information, I would ask you to go to the website. This is information from a 2-page document that they provide in terms of a summary. So I think this is my final slide. And I would just like to say that even though I've highlighted some of the extreme burden, and I know that you on this call are very much aware of the prevalence, incidence, and the burden that people live with day to day with the respective neurological disorders that you represent and are living with. But there's reason to be positive. Never to date has the neurology or brain health community been in such a high priority area at the political level and at the policy level. And a conjunction of the NCD initiative with the Global Action Plan couldn't be timelier. The European community is now presented with a unique window of opportunity to provide an integrated and cross-sectorial response to neurological health. And investing in this holistic model can and will bring measurable health and economic gains to European countries. And personally, I hate always having to bring it back to the money side of things, but you need to address that to your politicians at the local level, because money talks and money makes action. And what we hope and aim for with the action that will come from all of these initiatives is that there will be a decrease in the incidence of neurological disorders, improved survival rates, reduced complications and disabilities, a lowering of treatment costs, and ultimately ensuring a better quality of life for all of those affected. And it is up to us and you on this call as patient and public advocates to support the implementation of these policies and these plans at regional and local level. And step one, and if I draw your mind back to the Global Action Plan, which is around creating awareness, is making sure that neurology is a public health priority and really present this data at the political level to the health ministers, to the Minister of Finance, those who are involved in social protection and welfare. There's a real opportunity now, and it is up to us to take this opportunity. So thank you for listening to this presentation today, and I wish you all a very healthy and happy World Brain Day.
Thank you so much, Dr. Galvin, for that fantastic presentation. Certainly making it so clear to us that we're really at a very opportune and a momentous, not to overtalk it, but certainly a momentous time. And we just had in the Neurological Alliance, we had a letter published in the Irish Times this week, just drawing attention to the fact that the Global Action Plan had been published in May, and just, I suppose, contrasting that with where we are here in Ireland in terms of the prioritisation for many areas of neurological care. we had a very good question come in on the Q&A, if that's okay. I might just pose it to you on behalf of Eamon McPartlin. He's the chair of the Functional Neurological Disorders Hope Ireland Committee. And he just asks, a national neurological strategy is only as good as the funding provided by government. How will the Global Action Plan put pressure on government to provide adequate funding? And I think you addressed that in your closing comments, but just maybe if you want to comment on it there.
Yeah, so one of the strategic objectives of the Global Action Plan is to promote further resources into research and innovation. And we, as patient advocates at the European level and also at the national level, should really be highlighting that to our politicians and our ministers. Again, there will be opportunity with the Healthier Together strand, which really, you know, I would say with the Healthier Together strand, that's where you need to engage your politicians more at the national level, because that is going to be a collaboration between member states. So really the political level, it's not going through patient organisations, it's between the Commission and the member states about what funding goes into that particular strand and where then it's allocated. So that's a conversation and an awareness that needs to be brought at the political level to engage with the Commission on this. So absolutely, it is only as much as can be funded. I'll draw your attention to another week. So there's the Non-Communicable Disease Alliance. So there's a week at September 5th around taking action. And again, I would draw your attention to their push and drive to invest to protect when it comes to neurological conditions. So NCDs as a whole, but again, utilising that opportunity and pushing forward the objectives around investing into research at that level as well.
We'll certainly keep an eye out for that. And here in NAI, we're already mobilising how we're going to use this. And you were saying, Dr. Galvin, that there will be more information after that yourselves meet with the World Health Organization in August. There'll be more of a roadmap for countries. And we're certainly looking forward to that, because we're very keen to mobilise here with our local structures and our local government around the implementation of the GAP. Yeah. Can I just ask one question there before? Oh, sorry, go on ahead. Yeah.
I was going to say, you know, it sounds like a long road. It's a 10-year plan. However, at the moment when we look at other plans, it's only reviewed every so often after a number of years. What we are pushing for through One Neurology is to make sure that there is an appropriate watchdog, if you like, at sub-regional level to ensure that countries are progressing through with the Global Action Plan in terms of meeting those targets, and that progress is made in a timely manner, and that it's not a case that 5 years pass and you know not very much has happened. And that is another role that the patient organisations can play, and that national alliances can play in terms of reporting on improvements, and more importantly, when there's a lack of improvement, that is picked up and addressed.
Perfect. Thank you so much. And I'm just seeing in the chat there, we've had a great response to our poll, and 91% of our attendees would be interested in a further information event to find out about the Global Action Plan. So we might be having you back, Dr. Galvin, if that's okay. And we're certainly very much looking at this space in the NAI for later on this year, how we can inform our members more about the Global Action Plan and then move towards mobilising those members in a collective response here in Ireland in partnership with yourselves. And we're also delighted to be members of the One Neurology campaign, and we'll continue to work with that partnership as well at EU level and also at international level. I'm conscious that we need to move on to our next speaker. So thank you again for that fantastic insight into the Global Action Plan.
Thank you.
I just see someone that they raised their hand, but maybe if I can ask them to put their comments in the chat or the Q&A there. Okay, so I want to turn now to our next session entitled Patients as Partners in Digital Healthcare. And I want to introduce Laura Kavanagh. She's the Research and Advocacy Manager, to speak about the issue of digital health and information, and hopefully bring us up to speed with some long-awaited progress in this area. I hope I'm not wrong there, Laura. And ensuring that there's full involvement and engagement with patients in this process. If I could turn now to yourself, Laura.
Thanks very much, Mags. Hopefully everyone can see my slides there. Again, sometimes I find them hard to see myself. I tend to be over in another screen now, but hopefully that's working. My name is Laura Kavanagh, as Mag says. I'm the Research and Advocacy Manager here at IPOSI. I've been in the role for about 8 years now. I don't actually come from a health background myself. I come from a human rights background, having worked with the UN and Council of Europe in different structures internationally for many years. But I find the more I get involved in this space and the more I speak on behalf of IPOSI, I think the emphasis is always on the individual and on the person, the citizen, the service user. And I think this emphasis and the emphasis on the rights that those individuals hold is a really important starting point for these sort of conversations, and none more so than for digital health and health information. So I hope to take you through a couple of things, but first I'll just let you know a little bit more about IPOSI. We are a patient-led public-private partnership. We have a number of patient organization members, over 100, about the same number of individual patient advocates, and that number grows over the years as we have our patient education program and more people pass through it and join the network. We have about 200 people from academia, scientists, researchers, and we have 22 healthcare companies. And together we engage in discussions digitally for the last couple of years due to COVID, but we've had a lot of discussion, especially last year. We held 3 digital discussions on digital health. So if anyone is particularly interested in this topic and wants to take a look at the recordings or the outputs from those discussions, they're on our website, www.iposi.ie. We're in the process of actually changing our website to be a little bit more navigable. So if anyone wants to contact me to obtain the documents, they're more than welcome to do so. We also tend to hold annual in-person conferences when we can. The last one we had in 2019 before COVID was on the electronic health record. And again, there's material from that if people are particularly interested in the topic. On an ongoing basis, we conduct training for patients and service users, for people who are interested in the health space, but also increasingly for people who are attached to companies or who are attached to universities, or even within the healthcare professional setting themselves. For patients, we offer training around the medicines research and development process, around clinical trials, medicines regulation, health technology assessment. There will be a course in 2023, so again, there are details on the website. In addition to training, we also prepare resources for our members, so for patient organization leaders, but also for patient organization members. So around digital health, we have a campaign for this year and the rest of the year and probably into next year, to be honest. And we'll be producing resources like fact sheets, which explain a little bit about what is an electronic record, why is it important, what is a portal, what is an individual health identifier. So these resources will be coming online towards the end of the year, and hopefully they will be useful for people to go and view and to share. We also build coalitions around issues that are important. So if anyone is familiar with our work, you might have seen last year there was a coalition around vaccines and access to COVID treatments, and NAI was an important part of that coalition. So we thank you for your support. And this was to try and increase the prioritization for people with chronic and rare conditions for access to vaccines and treatments. So that's an example of our coalition building, so to say. And then finally, one of the things that we've started to do, we've been doing it virtually since COVID, is our citizen juries. So we held a first citizen jury last year on access to health information, mainly for secondary use, so for research and for innovation. And this year we've just finished a citizen jury around the future use of genomics in healthcare and research. So the report from that jury will be forthcoming in September. So there's a lot of different things happening in IPOSI. If people are really interested in the topic, please feel free to just reach out and contact me directly. As you can see on the screen, we have 3 priority areas. Digital health and health information is obviously one, and I've talked about that. We also have 2 other priority areas: access to innovation, medicines, medical devices, new therapies, and our second one, patient and public involvement. And I was delighted to hear Dr. Galvin mention patient and public involvement in her presentation, because it's really important that we start to think with this lens all the time. Where can we involve the people who have the lived experience in the decision making, in the project implementation, in the evaluation? So it's a key focus for us here in IPOSI. Moving to the topic for today, IPOSI and digital health and health information. And I mean, we are involved in a number of different fora which try to move the issue forward. We are involved in the COVID Biobank, with eHealth Ireland, with the COVID app when it was applicable. We're also involved at the European level with Data Saves Lives initiative. It's a European initiative that has a lot of useful resources around digital health and around health information management and health information ecosystem. So if you're particularly interested, again, it's a resource that I would encourage you to visit, Data Saves Lives. We're also involved with the OECD Paris survey and with the UPATI Patient Academy, which again has a number of resources around the medicines research and development process initially, but they're now also moving into the digital health space a little bit. So I'm not going to go into what digital health is, because I am by no means an expert in this area. So I'm not a technologist, I'm not a clinician. I really come at it from a civil society sort of lay perspective. And it's kind of a catch-all term that means many different things to many different people. I guess when you're hearing it, you might hear about e-health, you might hear about m-health, you might hear about connected health, telehealth, precision medicine, all the different bits and pieces that go into it. But for us here in IPOSI, and it's really back to the statement that I shared at the start, digital health is all about people for us. And, you know, digital health, one of the important components is health information. Health information comes from the individual or the service user. So health information is patient information. So with that in mind, as we follow that kind of thread through, it's really the individual or the patient that holds the key to unlocking this digital future that we're all trying to work out what it should look like and how we should put it in place. And it's really important that individuals and patients and service users are part of this conversation, are equal partners in this conversation, and really have a key strategic role in co-creating this digital health future. The decisions that we make now, the things that are being put in place now, are going to affect us all for many years to come, in terms of what our health system looks like, how we access services, how we access our own information, what information is collected about us, how it is used. So it's really, really important for us here in IPOSI that patients and citizens, to a certain extent, are part of this conversation. So I've talked a little bit there about IPOSI and health information. And for us, health information must be collected and shared and used in a digital format. And I think, as Mag says, and as Emma mentioned in her opening remarks, there have been positive developments. Things are starting to move in the right direction. People really no longer defending paper records. There's very much willingness to move forward with a digital agenda. And there's a recognition of the challenge, and that this system needs to be put in place carefully, probably in a step-by-step process. We need to make sure that we are interoperable, able to share information nationally, but also able to share information globally with our European member states, but even further beyond. So there's a real recognition that we need to start to put in place this digital health information system. The second point on the screen, I think, is one where the ethical argument or the argument has been made in principle, but where we really need to make sure that this happens in practice. So health information must be readily accessible in full to the individual to whom it relates, i.e. to the patient or to the service user. I think this is still something that we really need to talk about. I'll share a little bit about the developments in the health information space, policy and regulation and legislation wise on the next screen. But I think this is a really key important principle that we need to bear in mind as we consider these issues. Health information must be accessible to the individual to whom it relates. I mentioned the citizen jury earlier on. It talked about access to health information for secondary purposes. So not using information for just your own care, but also using information to inform research or to inform innovation. And so it's our belief in IPOSI that we should try and see where possible, where appropriate, where the individual consents, that information can be used for both primary care amongst clinicians, but also for secondary purposes among researchers, among people involved in the innovation space. And I think that I've kind of mentioned the fourth one there, which is that health information should be shared and used on the basis of individual preferences. So what the individual consents to and what the individual understands that they're consenting to is really important here, especially in the health information space. So to share a little bit about the key developments, which is really probably the crux of what I wanted to talk about here today. Some of you may have seen in the media, probably a couple of months ago, an announcement that there will be a health information bill forthcoming. And the Department of Health have started to work on this process. They are in the process of drafting what they call the heads of bill, and these should be available by autumn of this year. IPOSI has just recently submitted some sort of high-level observations around patient needs and expectations around health information. We've submitted them to the Department of Health last week. I can share them with Mags, who may be able to share them with you after this meeting here today. And we hope to be able to engage with the department further as they put more meat around the bill, so to say. There's more detail available at the moment. It's very high level, but there should be more information forthcoming, and hopefully there should be more engagement. But I would encourage you all to take a look at our submission, but also to kind of take a look at some of the information that's on the Department of Health website, because it's going to be a really important piece of legislation which kind of dictates how we move forward again for the next 10 plus years. HIQA, obviously, the Health Information and Quality Authority, have a role in health information. We have sat in a number of their advisory groups over the last couple of years around consent, around patient summary care records, and the latest draft paper that should be coming from them at the end of August, I believe, beginning of September, is around the policy considerations for health information. And this will be reviewed carefully by the Department of Health as they prepare their bill. And I think they really have 4 policy considerations that they speak to. Fortunately, one of them is public engagement, and we're delighted to see that public engagement is really at the forefront of what HIQA considers to be one of the 4 key pillars for health information. But given that the bill is currently being drafted, it's really important that this engagement starts or continues or ramps up with earnest in the coming months and years ahead. The National Children's Hospital, obviously we'll all have heard a lot about this in the news. One of the components of a new children's hospital is a digital health information ecosystem. And so the National Children's Hospital will roll out an electronic health record. And as part of the record, there will be a portal where patients can log in and see their health information. Now, I guess work has started on the record. It's a 22-month project. It has to be done very quickly, relatively speaking, by the time the hospital opens in 2024. They have been engaging with IPOSI. They've also engaged with a number of other patient and public involvement structures that they have set up in the hospital over a number of years. And so there are patient voices feeding into this process, but it will be interesting to continue to follow how the record is being developed, but also, more importantly, what access patients will have to their own information. Will it be a summary care record, which is, you know, very high level information, or will it be a full record of all the health information about an individual which the institution keeps? So it will be interesting to see which avenue is pursued. The fourth point here, I guess, is around the e-health strategy. Now, the e-health strategy was produced first in 2013. It is obviously in need of revision, and it's in need of new energy, really, to be honest. And I think there is a recognition within the Department of Health and within the HSE that this needs to be done. And so efforts are afoot to revise this strategy before the end of the year. So I imagine that it times nicely with the Department of Health Information Bill. So work is ongoing, and there is due to be a public engagement around a draft strategy, probably in the autumn of this year. So again, it'll be something to keep on all of our radars as we see it coming forward. Sláinte Care obviously has a very strong digital health, e-health, I think is the term that they use, component. I think I've written Objective 10 here, but I think it's actually now called Project 6. There's so many changes to the Sláinte Care documentation, but I think it's called Project 6. And under that, you'll see there's the 2022 action plan. There's also an action plan for 2021-23. And you'll see they kind of detail some of the e-health projects that they are prioritizing to undertake during this period. Sláinte Care originally talked about a national electronic health record. It now seems that there's going to be smaller sort of institution-led records set up and then maybe joined up at a later stage. So there's been a slight shift in that. Sláinte Care also talked about a portal or citizen access to their information. It'll be interesting again to see what that actually looks like, especially as we will have the sort of pilot done by the National Children's Hospital. So I guess there's a lot happening at the national level. It's really important that the opportunities to engage with this agenda are taken. It's really important to push for more opportunities to be made available for the public to engage with these processes, because, as I said, the decisions that we take now will be the decisions that we live with for the foreseeable future. And I think the final point is just that at the EU level, there's also a lot of momentum. I mean, COVID has driven a real interest in digital health and in health information, and the EU has kind of taken this up and moving forward with it. There's a couple of commitments coming up now in 2025 around member states should be able to share summary patient care records across borders. They should also be able to do e-prescribing across borders. So there are things that are coming up in the foreseeable future that Ireland really needs to work towards meeting those commitments and being part of the process together with the other member states. A little further down the line, there's now a commitment at the EU level that by 2030, all citizens would have access to their full health information. So if this is a commitment that Ireland intends to honour, it's really with urgency that we need to get moving ahead with our strategy, with our infrastructure, with our investment. I just have there in the bubble at the side, within IPOSI, we're always thinking, you know, what is important to Irish patients and where can we take joint action together? And so opportunities to speak like today are really important for us because we are very interested to engage with patient organisations and patient advocate groups around this topic. So if anyone wants to reach out to me after this meeting, you're more than welcome to do so. the Health Information Bill, just in a little bit more detail because it's so important and it will be crossing many of our desks now in the next couple of months. There are three key components. There's the National Health Information Guardian, which is a model that has been adopted in the UK and I guess is being tailored to the Irish setting. This guardian would have a role in kind of advising on strategy, a role in overseeing how things are done, and a role in protecting the interests of the citizen. From our point of view, it's really important that in deciding what the exact role and responsibilities of this guardian is, that there is patient and public involvement, so that it's really built from the bottom up. One of the other things we'd like to see is that as the role is pushed out, that there is a panel of patients and public members supporting the work of this guardian, who are able to highlight their concerns, able to bring issues to his or her attention going forward. So we'd really like to see that public patient panel set up alongside the guardian. The second component, which will probably be addressed by the bill, is a National Health Information Centre. And this is all about creating a data sharing environment. I think many people realised that GDPR was an important piece of legislation, but a difficult piece of legislation to interpret. And perhaps many member states have been cautious in its interpretation. And perhaps this has led to data which would have otherwise been shared no longer being shared. And we by no means do we want to see data being shared where it's not appropriate, but where it is appropriate, it's important to be able to facilitate this sharing and to be, for people who are doing the sharing to be confident that they're doing it in an appropriate and legal way. And so I guess this Health Information Centre will have a role in kind of ironing out some of those challenges. For us, it's really important that as we move forward with any approach, that there's a public and patient voice. So again, we will be calling for the governance of this centre to really involve the public and patients in their mechanisms, in their implementation, in their evaluation. And then I think the last piece, which I've kind of already touched upon, so I won't spend too much more time on, is that the bill will address this rights package. As individuals, we have health information collected about us, but what are our rights when it comes to viewing it, editing it, carrying it with us, deleting it, sharing it? There's a lot of different rights that need to be attached to it. And often we've seen in the past when people talk about rights and health information, they talk about the right to privacy. They don't really talk about the right to view, the right to manage, the right to access, the right to edit, the right to amend. So we'd like to see a really comprehensive set of rights put forward in this bill. And we hope that the patient community supports us in doing so. I think I've talked a little bit already about what's happening at the EU level, so I'll move on here in the interest of time. And really, what can we do as patient organisation groups, as kind of a network of people who are interested in health information and digital health, and as individual patient advocates? Well, I think our experience from the citizen jury shows that people are not necessarily terribly aware of the ins and outs of arguments around health information or digital health. But when they're given a little bit of detail, they are very, very capable of taking up the issues and sharing their perspectives and their needs and their expectations. And so with this in mind, we're really interested to see as many people as possible getting behind this topic, sharing their views, sharing their perspectives. Here within IPOSI, we are certainly not scared of the different perspectives that exist out there around this topic. We welcome them. Part of the work that we do is trying to find consensus among different perspectives. So we are very interested in having conversations, in facilitating conversations, and in raising awareness around this topic. So we would encourage people to, attend any trainings that are available around digital health. We would also encourage people to engage with organisations like ourselves if they're particularly interested in the topic, if they think that there's a group of people who are interested in hearing about it further, to reach out to us, and we're happy again to come and speak at events like this about digital health and about health information. We'd like to see people kind of go back and tell a friend, you know, or tell 3 friends or tell 4 friends about what has been heard here today and about some of the issues that have been raised, because the more people hear about it, the more they realize that it really is something that's going to affect how health is done in the future, the business of health, so to say. And so it's really important that the patient and the citizen voice is injected into the decisions that are made, the policies that are put in place, the legislation that is passed. So I think I'd leave it there. Mags, I'm happy
Perfect.
to pass over
Thank
for
you, Laura.
any questions.
That's great. What I might do, I'm conscious, Laura, that our other speaker in this session is joined as Professor Colin Doherty. And I suppose the epilepsy electronic patient record was one of the pioneering pieces of work in this area. I think it'd be very interesting if I invite Professor Doherty to speak, and then maybe just take the questions together, if that's okay, because I think the 2 of you will share very interesting perspectives on this, and what his view is of the current progress or lack of progress in this area. So Professor Doherty, could I invite you to address the audience at this stage?
Good morning, everybody. I'm just sharing my screen here. Let me just see. Okay, so I guess I have about 15 minutes, Mags, is that right?
Yeah, yeah.
So you'll have to cut me off. Just do that with your hand. I can see you in the corner there if I have to stop. So this is not, that last talk was very interesting. I only caught the second half of it. I had a sense from the talk that there's a lot of work to do to get ourselves, our population, our citizens ready for the emergence of digital health. But I'm taking the perspective that that's not a given. It's not a given in our health system today that we are going to have a digital health program, not at least one that's comparable for a modern European economy. And this is a picture of really what are called the industrial revolutions. And you know, we are this is the fourth, what's called the fourth industrial revolution, artificial intelligence. And we are way behind. We are still in the electronics and computers end. And that's true of medicine everywhere. And there are both good and bad reasons for that. Medicine is a conservative organization. It doesn't jump to innovations very, very easily. There are good reasons and bad reasons for that. But the bottom line is we are still mired in the early phase of computerization. Many of you will go to your doctor's offices, your specialists, and you will see them writing still in their notes pads. And you know, the idea that in their daily lives, these guys are going home and talking to their Alexa and their Apple Watch and their Siri, and everything they're doing is being driven by AI technology. You know what I mean? They go into their offices and they're taken out of paper chart. And that's still common, and it hasn't been fixed. And I think there's a call to action that what was being talked about previously by Laura, you know, all of these, this knowledge and governance around data that's digital is required, but we need to have the data first. We need our practitioners putting this data in first and foremost. And on World Brain Day, I'm saying we need to do this now. This is a call to action to influence the people who can make those decisions. And if it's not going to be you, who's it going to be? Because, by the way, doctors and academics and stuff talk to politicians and talk to fund holders all the time. But actually, it needs to be citizens. You know, when you deal with politics, you know that actually it's citizens have a much more powerful voice than professionals. That's just the way it is. So what's going on, and why is this so urgent? It's not just that the rest of Europe is going to be ahead of us and, you know, that sort of stuff. That's not it. We have very significant predicaments in modern healthcare. We have poor prognosis and patient safety. We have increasing professional burnout. We have deteriorating doctor-patient relationships. We have assaults on privacy of health-related data, and we've increasing costs. And the question is, what is the battle now? The battle lines are drawn. We have to be very clear that the promise of machines will help to improve these things. We have to make that argument, because if we're just adding digital technology and not addressing these very, very significant healthcare problems, then, you know, I wouldn't be convinced to fund it and to invest in it. just to give you some simple examples of patient safety problems. So the Harvard Medical Practice Study in the US, and we've no reason to believe we're any better or any worse than the US, estimated geriatric injury, the number of people hurt by the health system is between 98 and 180,000 deaths per year. And there was horror at that figure. And everybody said, oh no, it can't be that high. And there was a lot of pressure to put pressure downwards on that figure. And they decided, well, it's probably near the lower figure. It's like 100,000 people dying every year. Here's an example. So if you accept that 100,000 people might die of medical misadventure, the number of people dying of motor vehicle accidents of breast cancer doesn't amount to that. So that's a startling figure. The total number of medical errors and deaths equals 3 jumbo jets crashing every day, right? Every 2 days, rather. So if you think that in 2015 there were no domestic airline fatalities, you know, imagine if 3 jumbo jets were crashing every 2 days, what they would do to the airline industry to change it. The rate of error in the ICU is about 1.7%. That'd be like the post office losing 16,000 pieces of mail every day. 7,000 patients are dying every year because of sloppy handwriting. 7.5 million unnecessary medical and surgical procedures. More than half the US population has received unnecessary medical treatment. It's estimated that of the 80 million CT scans done every year, half are unnecessary. Well, that's an incredible figure. So now we believe, and this is the latest figures, that medical error is the 3rd leading cause of death. And again, no reason to believe this is any different anywhere else. And it's responsible for about 400,000 or more lives lost every year. The 3rd leading cause of death, 400,000 lives. So we're getting worse. I mean, it may be that we underestimated it previously, but we certainly have made not the progress in patient safety that we need. Here's a little graphic of professional burnout. 44% of physicians. Now, these are pre-pandemic figures, right? You can only imagine what is going on in the minds of clinicians now post-pandemic. 1/3 of nurses are on burnout. Half of people are using 50% of their time using the EHR. So that's a digital solution, but it's taking up half our time. Loss of sleep, loss of quality of life. So these are very real figures, and everybody out there who's listening to this has probably experienced some level of this. And then this, sorry, I can't go forward here. This is a study which was published in 2017, and it was by a surgical unit. Patient perception about their physician in 2 words: impatient, condescending, arrogant, hurried, rude, rushed, busy, poor. And there's definitely a connection between those burnout figures and these experiences of patients in relation to the deteriorating relationship between patients and their doctors and their nurses and their clinicians. So in a very real sense, all of those are feeding this patient safety problem. And then we've got the idea that social media has told us that privacy is no longer a social norm. Everybody puts in their Facebook data and they get sold off to companies. Yes, sure, there are some legislation around that now, but believe me, it's still happening. What people don't understand is that they are the subject. They're not the patrons. They are the subject themselves. Their data is being sold to companies all over the world. And we have things like Google's secret cache of medical data includes names and full details of millions. And this is still happening. And we're only 1 day away from the next headline showing that people's medical data has been shared and sold to private companies. And then there's the cost. So the health expenditure, this is the OECD middle, 9% of GDP at the moment is the OECD average. Ireland here is a little bit lower. And now this is pre-pandemic data, 2020. Look at the United States is 17%. And then we've got these figures which showing that there's a divergence during the 2008-2010 financial crisis. In Ireland, for instance, 30% was taken off the health budget, and at least GDP mirrored the spending in health. But health has gone off the railings, even pre-pandemic now, compared to GDP. So there's a big discrepancy between costs. And all of these then can be sort of summarized in this. This is our experience of healthcare in Ireland. Crowded emergency rooms, crowded outpatient departments, terrible kind of maze journey to try to see the kind of the clinician that you need to see. And then you see these records on people's desks. And as far as I'm concerned, that's the norm. It's not the norm to do what we did in epilepsy, which was, well, before I talk about what we did in epilepsy, let's just summarize these challenges now for digital health. So we need to work with patients and the public to create a demand. This is what I'm talking about today, creating demand in, and IPOSI's role has been to create that demand, but also to build the trust in digital health mediated health service. We need to advance the application of big data, AI, and robotics in research and clinical care to deliver better, safer, more value-conscious care. So we need to address this massive problem in the patient safety, the hole in patient safety, and we need to address costs. And we need to build truly learning health systems that preserves safety, trust, dignity, rights, and compassion in healthcare. That's not a small ask, but I do believe that we do have the potential to do that if we harness this digital revolution properly. And this is just a very simple graphic showing that, not to go through this in laborious detail, but like the digital record process in epilepsy started in 2004, and people like Mary Fitzsimons, someone you will know, Norma Delanty, myself, Maura White, Cora Flynn, some of these people are still here, some have retired. We started this idea that we were going to start to collect data from patients. Even in 2004, telling your friends at a dinner party, oh yeah, we're going to collect patient data, we're going to put it on a computer so that it's shareable with the patient, with other doctors, people would laugh at you. That was 2004. And the fact that we've reached now and we still have most of our health service mediated with unshared data, even if it's digital, it's not shared, it's not interoperable. And obviously there were various highlights of that, including the development of the patient portal and the epilepsy program becoming a lighthouse project and winning a Taoiseach's award. So we've been lauded as this, this exemplar of digital record keeping. But we still don't have the investment we need to keep it going. And this is just some of the highlights. 10,000 individual records now. That's about a quarter of all the patients with epilepsy in Ireland. We have regular MDTs are conducted using the EPR, 11,000 clinical encounters annually. 43% of these are done digitally and are done virtually. And that's mediated by the fact that we have a digital record in front of us. We have 112 active clinical users in the last 60 days. We have genomics and multidisciplinary meetings since December 2016. And 63 patients and families have engaged in the design of some aspects of the portal. And, and some of this has been mediated by this process. And this process is something I'm very proud of. Jack Banks, some of you will have met. He's not a clinician, he's a researcher. And Jack came through the Health and Human Diseases research program in Trinity, and now he's a postdoctoral researcher in Texas. And Jack did a study looking at what was it like to live with epilepsy and how could technology mediate improvements for those people. And I'll just highlight some of the things he did. One thing that really strongly came out was the amount of difficulties people have with their memory, and that has a significant impact on one's life, but it also has a significant impact on the kind of technologies that might benefit you. Because if you're having trouble with your memory, then using some complex technology to mediate your care is a problem, and it needs to be taken into account in designing technologies. Maintaining employment, building a career is seen by people with epilepsy as nearly impossible. I mean, for clinicians and services that have as their goal to keep people independent with their epilepsy, this is a really big home truth. So most people with epilepsy feel that once they get this diagnosis, they can't realize their vocational and occupational aspirations. Again, that has to be central to improving the experience of people living with epilepsy. And the outcome of this engagement was that we generated lots of ideas about improving the experience of epilepsy self-management through e-health, and Jack has fed those back into publications and into the kind of work we do around technology. And all of that was coming from the patient, just in that idea of partnership. This is what the portal looked like. Now, the portal was a project that started up about 4 or 5 years ago. And as I said, 63 families and individuals were involved in the designing the portal. This is what the front page looks like. Now, what's interesting about this is we had no idea back in 2004 that we were going to be arriving at this point. Like, the epilepsy digital project has been a learning health system. We've begun to learn all the way through this process the kind of things people want from us. And the idea that people wanted access to their notes, they wanted to know what we were sharing with their GP, they wanted to be able to put in how they felt about it. They want to prepare for their visits to their doctor by answering certain questions. And that's where the portal came from. It came directly out of the engagement with patients. And you can see here that it's, patients were allowed to put their goals in, prepare for their preparations, questionnaires about quality of life, and a summary of their epilepsy. And that whole thing was a very good example, I suppose, of this patient co-design process. And I've been working, as some of you know, and by the way, I know some of the people on this call were part of these. And so without naming people, I want to thank those people personally, because, you know, we've built the reputation of the digital record on the basis of co-design. It has become the success it has become because of the involvement of the patients. And working within FutureNeuro, you know, we've had various publications. This is our latest one, democratizing epilepsy care. And that word democratizing really came from Mary Fitzsimons, who wrote this paper with me and the other members of the eHealth group. And I think it's a great word, because it is about transparency and accountability and democracy. It's about all that. And of course, we know that we have all of these engagements through FutureNeuro across and through the clinical program across the various hospitals involved. And we do inform policy. And this was a report done by Brendan Walsh at the ESRI, Developments in Healthcare Information Systems in Ireland. And this is just one quote: the Irish National Epilepsy Electronic Record and the subsequent development of the electronic patient portal have facilitated changes in patient care pathways, improved patient-clinician contact, and engendered greater patient self-management. These structures provide Irish policymakers with a template for expanding an EHR to other patient populations, ultimately establish a national EHR. I mean, if it could be said in 50 words or less, that is the project we want. You know, getting a project done for people with epilepsy is important, but exporting that learning out to the wider community is really important. And this is what patient engagement has looked like now post-pandemic. And some of you will recognize yourselves on this. And FutureNeuro has been very great in expanding the idea of public patient engagement. And it's been really, really rewarding. And things that come out of that have been fed back into the core elements of the research strategy in FutureNeuro. So we know epilepsy. I mean, some of you don't, some of the people on the call from all different walks of life, some have chronic illnesses, some don't. But in epilepsy terms, you know, this is the figures: 40,000 people with epilepsy, 15,000 poorly controlled, 7,000 people admitted to emergency rooms, 120 deaths at least per year, and 30,000 bed days. This is not a small problem in Ireland. And the strategic needs of investment in digital health for epilepsy are to continue to put downward pressure on those numbers. And we have very good numbers showing that we've done that, reducing the length of stay, which we've done, and ensuing a patient-centered quality of care. But the problem is that we haven't got a commitment to invest in it. Our platform is teetering on the brink of obsolescence, and we have not got an agreement. We've great friends in digital health like Martin Curley and his group, but we have no commitment yet from the government to continue to fund this. And like, if we've done everything that we've done has been on the nose for the kind of things that I pose you have been asking: patient engagement, transparency, democratization of care, patient safety, improving and decreasing costs, improving the relationship with doctors and their reducing physician burnout. We've done all those things and we still can't. And if we can't get the investment from the government, when is it going to happen? Who's going to get it? Cost, technical, clinical challenges, difficult to scale. You know, all of these problems have been placed at our doorstep. And I think that we need your voice and the voices of the people on this on World Brain Day to make that happen. And I'm going to stop there. Did I do okay time-wise? I did.
You did indeed, Professor Doherty, and thank you so much for that. It's I had a feeling that was the situation, didn't realize the situation was quite so bad. Could I just, and look, you know, we've had so many comments. I was looking at this whole area when we were planning this event, and I was like, if I organize an event on health information for World Brain Day, no one will show up. How wrong I was. We're going to have to revisit this event because there's been so much, this topic, because there's been so much activity and interest on the chat and the Q&A and yourself and Laura's presentation. I'm conscious of time, and I have Professor Suzanne Timmons waiting in the wings with her presentation. Can I just jump in with yourself and Laura and just ask, do you feel, both of you, that I'm conscious when patient organisations get in front of a politician or get in front of the Minister of Health, for example, they have so much that they're asking for. This is down the line. They may not have a messaging around it. They may not feel confident in a messaging around it. Do you feel there is more of a need for a grassroots advocacy around this, for individual patient organisations to have this on their on their list of asks. And Laura, is there anything more we can do as IPOSI members around this?
Mags, I won't take up too much time. I would echo fully what you say. People don't necessarily have the bandwidth for this when they're going into a minister with a whole list of problems around services and things like that. I think if we can put it somewhere on the agenda for the next 6 months, it will carry much more weight than if we talk about it for the next 10 years again. I think now is the time to get out the messages that need to be gotten out. And here in IPOSI, we hope to support you with some resources around those key messages in the coming weeks, so that we can have a maximum impact, and so that we can see if there are any joint actions we can do from the grassroots level up. Yeah.
Great, thank you, Laura, because I'm absolutely not shutting this down. We're going to revisit this, and Professor Doherty, thank you for coming in. Just be reassured that we've heard you. This is on our radar. We have a couple of opportunities coming up over the next while, so we'll certainly be highlighting this and the issue of the epilepsy EPR in particular, and the investment that's needed in that. So thank you to both of you. We've really learned our lesson that this is definitely an issue of interest, and we need to give more time to focus on it in our future events and in our ongoing advocacy here in NAI. I just want to move at this stage to the third and final session of our webinar, which we called Changing Minds. This is where we're looking across, I suppose, the landscape of neurological care in Ireland, and some of the learning that we can get when we look across to other disease areas, other patient organisations. I'll be talking later on in this session about our Conversations on Brain Health series, our recorded video call series, and just some of the insights from the clinical leads in neurological care, and some of the challenges we faced on World Brain Day in the prevention, awareness raising, and integration of care for people with neurological conditions. But firstly, to start off, I'm going to welcome Professor Suzanne Timmons, consultant geriatrician, and I've asked her to talk about her perspective on brain health. Professor Timmons will talk about her background, including as previous national clinical lead for dementia, and just the lessons through the dementia strategy and in work that she's been doing since to promote I suppose the prevention, the living well with dementia, and how that's applicable and transferable to other neurological conditions. So if I could welcome you this morning, Professor Timmons, and thank you for your patience. We're running a little behind time.
That's great. And Max, can I just check? It's 20 minutes I had pitched to talk for. Does that still suit you? Or
that's okay. Yes. Yeah.
All right.
Okay. If we can shave off a couple of minutes, great. But look, I'm aware I gave you your time. So
yeah, no, that's perfect. Well, I'll err on shortness if I can. So I'm just going to share my screen with you here now. So you might just confirm for me that you're able to see it.
That's great.
Yeah, lovely. And I'll get started there from perfect. So listen, thanks a million for inviting me to talk today. And I am going to talk a little bit about brain health from the experience we've had within the National Dementia Office. So some of you will be familiar that the National Dementia Strategy was launched in 2014. And sorry, now I'm just going to, I'd love to shut this down. I'm not sure if you can see this black bar up the top that I'm seeing. But anyway, so it was launched in December 2014, and it would have had 6 pillars, and you'll see those yourself. Awareness and understanding was a big part of it, as well, of course, getting diagnosis and getting support. And I suppose in terms of how this was implemented, a National Dementia Office was set up in 2016, and it was really challenging because there was 35 different action points within the strategy, and all of them were important. And it covered right from public awareness, risk reduction, through to getting a diagnosis that was both timely and accurate, post-diagnostic treatments, personalized support for the person and for their family, palliative care, and end-of-life care. So that's a huge remit when we think of the journey of a person with